All right. Welcome everyone to this next part of the Inner Source Health webinar series. Today we're going to be talking about inflammation and the role that it plays in health outcomes. My name is Dr. Robert Kachko. For those of you who don't know me, as I mentioned earlier, Dr. Peter was going to be joining us. I think he might be having some technical difficulties, but what we'll do is we'll get started. I'll give a brief intro on myself. I think that's what he wanted to do. I practice here at Inner Source Health. Let me actually skip to the introduction slide. I practice at Inner Source Health. We've got offices in New York City, right across from Penn Station, and in Huntington, Long Island, and some presence in Connecticut as well. So if you've got family and friends who might be interested in learning more about us, certainly send them our way. I also do a fair amount of work in the advocacy realm in our profession, incoming president for the American Association of Naturopathic Physicians. And really the goal there is to ensure that naturopathic medicine, and I assume the people listening know what naturopathic medicine is and are familiar with us in our practice at this point, but the goal is to ensure that naturopathic medicine really is a household name in the US. When people think about their healthcare, our goal with A&P is to ensure that on the one hand, our providers are ready, willing, and able to offer that type of care to the comprehensive level of support that we really ascribe to, but also on the other hand, that people out there have access to naturopathic medicine. And then finally, the last couple of years, I've been working on a healthcare technology startup based on this understanding, and we're going to touch on this a little bit in this two-part series, based on this understanding that when people don't get the support they need, they're less likely to get well. And so really our goal is to offer that kind of support through technology, but also through in-person connection. At Inner Source Health, that's a core part of our philosophy. We have this idea of a biopsychosocial approach. And today we're going to be talking about inflammation and the role that inflammation plays in health outcomes. And the challenge with inflammation is that it's really about finding the right balance. Inflammation, as we'll get into in a moment, really does serve a role in terms of most types of chronic diseases, but it also plays a role in terms of expediting our healing, depending on what our bodies are exposed to in our combination of genetics and environment. So without further ado, just a reminder, this is part one of two parts. This recording will be sent out. And so if people are listening to this ahead of part two, if they weren't able to make it today, you won't have missed anything. Part two is next Wednesday on December 11th, the same time, 2 p.m. Eastern time. So really the goal with part one is to set the stage, to understand the role of inflammation when it comes to chronic disease. And my goal will be to not make it too theoretical or philosophical, but really give you some practical advice so that you can go to your doctor, whether you're working with an ND or another integrative provider, or you just see your primary care doc, to allow you to feel equipped with the toolkit you need to really be proactive and empowered in helping yourself heal. Inflammation is at the root of a lot of those things. As a reminder, nothing that is said on a webinar like this is ever meant to be considered medical advice, and even the recommendations made are generally based on the research we have in our clinical experience, but they're not meant for the people who are actually on the call. So I told you a little bit about myself and getting into our agenda. Really, today we're going to cover parts 1 and 2 here. A little bit of some of the epidemiology on inflammation and why it's important. And then we're going to spend most of our time today in this 30 minutes of lecture really learning, well, how do you know if inflammation is a factor for you? How do you know if it's something that you need to be concerned about? In part 2 of the series, we're going to really tackle parts 3 and 4. What can you do about it is sort of the overarching theme there. And so, I commend you for being on a webinar series like this. I think there's a little bit of a selection bias for people who are going to take time out of their afternoon to take charge of their health. And so you're probably a little bit more aware of the role that lifestyle plays in health outcomes. You're probably a little bit more aware of the role that inflammation as a general rule might play in chronic disease. The truth is, this is not a new idea. We've known that inflammation plays a role in people's health for a long time. It's kind of just becoming popular now. Everyone likes to talk about inflammation. You see this Time article on the screen before you. It's been called the silent killer. It's been called this public health epidemic that people are missing. The truth is, and you see listed on that magazine cover, it does play a role in things like heart attacks and cancer and Alzheimer's. And then the question becomes how much and how efficient are we at turning off that inflammation. So you see here, inflammation is at the root, or at least plays an important role in most types of heart disease. Almost every kind of cancer has an inflammatory component. Most diabetic and metabolic syndromes are related to that. I do a lot of pain management and brain health support in my practice. And at the core of supporting people who are dealing with any health outcome, whether it's pain or neurological disease or even digestive disease that you see on there, is ensuring that their inflammatory pathways are under appropriate control. So, of course, nothing is inherently good or bad. The one line is thinking makes it so, but from the other perspective, it's a matter of a dose response. A little bit of inflammation is good. In fact, the ability to mount an inflammatory response, which is our immune system's best effort to protect us from foreign pathogens, bacteria, viruses, but also from things like trauma and metabolic issues like autoimmune disease. The truth is our immune system and its ability to mount inflammation is what allowed us to evolve as a species. Without the ability to turn on our immune system to fight off things like bacterial infections, we wouldn't have been able to start eating meat in our ancestral history, in our evolutionary history. We wouldn't have been able to come down from the trees and allow our brains to grow. And we can spend a lot of time talking about the advent of cooking and fire and how that contributed. But the truth is, even with fire, if we couldn't protect ourselves from infections, we would not be able to evolve the way we did. And inflammation was at the root of that. The challenge is when that inflammation goes unbalanced and when it's too powerful in relation to the actual insult or the threat to the body, that's when we have trouble. And so everyone's familiar with this idea of acute inflammation. The most classic example being sorry, I needed a sip of water there. The most classic example of acute inflammation being from some kind of physical trauma. Most people have heard of the need to rest an injured ankle or to elevate it or to put ice on it. Well, these are all because when our body gets hurt, it mounts an inflammatory response to heal the source of that damage. That acute inflammation, though, should, after a couple of hours or days or weeks, depending on what's going on, resolve itself. And our body really is designed to do that in an efficient and effective way. Inflammation that becomes chronic is a whole different story. Once that inflammatory pathway continues beyond the initial healing of the injury, that's when we start talking about chronic inflammation and a predisposition for chronic disease. And the truth is, for most types of chronic disease, I use the classic example of Alzheimer's disease. This inflammation needs to be long-standing. For something like Alzheimer's, which we treat a lot of in our practice, it takes 2 or 3 decades for the types of changes, both inflammatory and otherwise, to occur before the actual symptoms are felt, before a person actually has memory loss in the case of Alzheimer's, or before the person has actual plaques in their arteries in the case of heart disease. That inflammation has been going on for a long time. So being proactive is important. And so on the one hand, that can sound kind of scary. Well, this is something that's maybe a fire burning inside of us for a long time. But the truth is, it's also empowering in the sense that it gives us an opportunity to intervene at an earlier stage. That is only possible, though, if we know when to intervene. And so what we're going to be talking about now is the importance of intervening. I titled this talk, Is Inflammation Making You Sick? Because these days people need something, interesting or at times, unfortunately, fear-inducing to grab their attention. But the truth is, the language that we use around health and disease can actually contribute and perpetuate that health and disease. And so I always like this cartoon here about the difference between irritable bowel syndrome, which is classically a non-inflammatory bowel issue, turning into, classically in the medical literature, we would say inflammatory bowel disease like Crohn's and colitis. Well, this doctor is telling this patient it's furious and vindictive bowel disease. The truth is, a patient who hears that is much more likely to actually have inflammation. So the language we're using is important. And that's really my reminder to tell you, the goal here is to offer a comprehensive answer. But for most people, there isn't a whole bunch of inflammatory stuff going on. It's about finding what's important for you. And that's where working with a provider is really important. The step before I'm working with a provider in an effective way is understanding what the actual role is for you. And so we're going to spend maybe like a minute or two talking about the role of the immune system. Basically, our immune system, which is the part of our body that, and a part of our physiology that turns on this inflammatory response, is everywhere. And really its main goal is to protect us from the outside world. The example that we use, and you see the lymph nodes are all over the body, our spleen, which is an organ that most people don't really know what it even does, has a role to play in the immune system. We have immune activity in our bone marrow and all throughout our gut. The gut is a really important pathway. And so there's an important idea that you learn maybe the first or second day of naturopathic medical school, that it all comes down to the gut. In the end, if you can help a person support a healthy digestive tract, everything else gets better. And the reason for that is our digestive tract is in partnership with our immune system, our window to the world. And so everything that we put into our body, the food we eat, the water we drink, everything besides the thoughts that we have, most likely is coming in through our digestive system. And so that's really why food is important. And the whole, maybe 2/3 of what we're going to be talking about in part 2 of this series is the role of an anti-inflammatory diet. The truth is, if our gut isn't healthy, our immune system is trained to attack things that it doesn't need to attack, or our immune system effectively gets tired and is ineffective at fighting off the types of things it's designed to do. All of that comes through our gut. And so we're going to keep coming back to this idea of the gut. And today, when we talk about the different types of tests that might be important, a lot of them relate to gut health and specifically inflammatory pathways within our gut. And so I said earlier that it really always comes down to a personalized assessment to make sure that you're not just, reading that Time article and worrying about, am I getting enough omega-3s? Am I exposed to things like Lyme disease? But really understanding what actually matters to you. And so that always starts with a thorough history in our practice. We can't help but spend an hour and a half with patients on a first visit because we really need to hear your story. Blood tests that we're going to talk a lot about in a moment, and another sort of integrative functional testing is useful, but it all has to be understood within the context of the patient's story and their symptoms. There are often times where people come in and they have, they've done a whole bunch of testing, probably thousands of dollars worth of testing, and it came back with a bunch of things positive, some inflammatory, some oxidative, some related to their gut. But the truth is, when hearing their story, that's not the core of what's making them sick. It's the body's response. It's the body's effort to heal itself and to keep itself healthy. So a thorough history, understanding based on our clinical experience what's actually relevant to your health outcomes is important, as well as a physical exam. Really, we have a lot of people who want to see us from all over the country and all over the world. We can offer that kind of support, but it's really hard to do unless we're actually able to see the person and conduct a physical exam to make sure that we're being very thorough and comprehensive. And then finally, once we have that history and that physical exam, we're able to do some laboratory assessment to really understand for that individual what's important. And so when we look at laboratory testing, and again, this recording will be sent, so I don't want you writing all this down very quickly. We can also send the slides if you have any questions following up, or if you want a PDF of these slides, I'd be happy to send them out. You can just email our practice at info@innersourcehealth.com or email me directly at drkachko@innersourcehealth.com. But the truth is, blood work can give us a lot of information. And so there's the standard blood work, what we're calling the basics here, things like a comprehensive blood count and a metabolic panel to look at liver function, kidney function, immune cell function. But we also want to look at your cholesterol patterns. We've done other webinars in this series talking about the role of inflammation and cardiovascular health, where our lipid panel, I think we titled it Better Than a Statin, when we looked at some advanced lipid testing. That all plays a role, and that's a pretty standard inflammatory assessment. We also want to look at how your body's handling blood sugar. There are some key nutrients that really are involved in our body's ability to mount an appropriate immune response, but also to turn off inflammation when it's done its job, right, to stop things from going from acute to chronic. Things like vitamin D and vitamin A that you're seeing on the screen. The omega-3 index essentially is looking at the combination of the most important anti-inflammatory nutrients, specifically EPA and DHA, and the percentage of our red blood cells that are composed of those anti-inflammatory nutrients, in contrast with the ones that are more likely to cause inflammation, like the ones we would get from things like red meat. Our red blood cell magnesium levels are important, as well as our hormone function. So without a thorough understanding of your hormones, it's really hard to say if you're able to mount an appropriate inflammatory response or not. So we have to take a look at things like thyroid hormone, your adrenal hormones, especially cortisol, which we're going to talk about in a sec, and even sex hormones, which aren't really considered commonly when we think about inflammation. But if your testosterone isn't right, especially for males, if your estradiol patterns are not appropriate, and if you don't have the right types of estrogen or estradiol, it can contribute to inflammatory cascades and sort of become a vicious cycle from that perspective. And then finally, it's becoming very popular these days to do genetic assessments, and that's a webinar that we have planned in the future, but we are going to talk about a couple of genetic assessments. The key to remember though, and this is a screenshot from a software program that we use called Opus 23 that really allows us to do a very deep dive, especially if someone's got like their 23andMe results or their ancestry results. The thing to understand is genes, which are becoming very popular to look at these days, they don't function in isolation. First of all, there's many genes that contribute to health outcomes. And when it comes to inflammation, you see on the screen here, there's a lot of different genes that might be important that we want to consider. The truth is, inflammation often comes with oxidation, the ability to mount an antioxidant response. And so there are other genes related to that. But then to take it a step further, genes aren't necessarily inherently good or inherently bad. It's a matter of what those genes are exposed to, what environment they're exposed to. And so we're going to just look very briefly at two blood tests that we can look at, which we'll come back to in a sec. One is called interleukin 6. You're seeing that at the top of your screen, IL-6. And the other is called CRP. Both of those are probably the gold standard at looking at, well, is this a person whose body is inflamed? Yes, we can measure that in the blood, but most importantly, if that person has a susceptibility, if they're predisposed to having more inflammation, that's a concern no matter what the genes are saying. And the good news is we can turn off the bad genes and turn on the good genes based on our lifestyle. And so take an example of CRP. CRP stands for C-reactive protein. Well, one of the best things to do to reduce our levels of C-reactive protein, and in fact, to turn off the gene that increases our likelihood of having inflammation as it's related to this molecule, is you're seeing on the screen here that large orange line that says mind body therapies in the body left. Yes, diet's important. Yes, certain nutrients that are listed here are important, but the best way to turn off the gene that's related to this C-reactive protein, this inflammatory molecule that most doctors are measuring, is actually to help the person better engage with their environment, improve their relationships, help with mindfulness techniques, teach stress reduction techniques, teach breathing techniques. So those are all those things that we do that in theory might feel like they're non-specific, but in this case, we have very good evidence to show that they actually reduce inflammatory pathways. When it comes to inflammation, we also have to look at a whole bunch of other things. And again, don't write these down within the context of this talk, which very honestly probably should be a 2-hour talk. We're trying to be efficient with people's time. There's a lot of things we have to look at. I mentioned the CRP at the top of the left. We have to look at things like fibrinogen, which measures the stickiness of the blood. We can look at things like in that middle column, fecal calprotectin, which looks at, based on our stool, if there's inflammation in our gut, which is the source of inflammation in the rest of the body. In that same column, you see something like rheumatoid factor, and the one at the top of that list, ANA, those are related to whether we have certain types of autoimmune conditions that could be contributing to the inflammation that we're feeling. And finally, I mentioned this idea of oxidation and the genes involved in that. If we can't mount an appropriate antioxidant response, it's really hard to keep inflammation at bay. And so there's a couple of molecules to look for to get a baseline. The one I like the most is the one you're seeing on there, 8-OHDG, 8-hydroxydeoxyguanosine, which is telling us, is there DNA damage at the very level of our cells? Is there DNA damage that might be a sign that our bodies are not doing well within the environment within which they're working? So all those are important, interleukin 6, CRP. I mentioned the idea of the importance of hormones. Cortisol is probably the king of those hormones when it comes to inflammation. Cortisol is our body's own prednisone, effectively. If you've ever been prescribed prednisone for an inflammatory condition, or if you know someone who's gotten steroid injections, it's really the same molecule, but our bodies actually make that molecule in response to the environment and, again, the genetics that we're born with. The truth is, a lifetime of stress, a lifetime of poor diet, inappropriate sleep, smoking, lack of exercise, you name it, can contribute to a cortisol pattern that is no longer conducive to health. And what we're able to do, either through a salivary test, which this example on the left shows, or a urine test, is to measure whether the cortisol response is appropriate. And as you're seeing on the screen here, you see the green arrow moving down, and then yellow arrow, or the green section highest in the morning and lowest in the evening, and the yellow following that, and finally the red section. Really what we want is people's cortisol to be the highest in the morning and to follow this nice sloping down pattern for it to be lowest in the evening, because cortisol, in addition to being involved in inflammation, is our main stress hormone. And so if we're stressed out, our cortisol might be too high throughout the day, and it might be impacting our ability to mount an appropriate inflammatory response. The alternative is that we've sort of burned out our ability to make cortisol, which is made in our adrenal glands, these two glands that sit at the top of our kidneys. And if that happens, we're no longer able to mount an appropriate immune response and inflammatory response, but for other reasons. And so what we really want to do is test to see where people are, and really in a targeted way, treat what we're actually seeing in the labs. And so a person who's got a cortisol pattern that starts highest in the morning and is lowest in the evening is much more likely to be able to appropriately deal with inflammation. And so we have to get that in as a baseline before we can do anything else, including some of those key nutrients that we were talking about. Next, we want to look at the gut. I mentioned the importance of the gut function and its ability to mount, again, an appropriate inflammatory response that doesn't cause us to have chronic disease. And that really breaks down to a couple of components. First of all, the flora, the bacteria in our gut can certainly contribute to whether or not our immune system is trained appropriately to mount that response. We can look at inflammation in the gut directly, actually through the stool. We can look to see, is there inflammation? Just a very clear test, a very objective test. We're going to talk about that in a sec. We also, and this has become pretty popular in recent years, want to look at something called gut permeability, often called leaky gut by people. And so if our digestive tract, which we talked about as sort of being the barrier to the outside world, if our digestive tract isn't able to keep the appropriate, isn't able to absorb the appropriate molecules and keep away the ones that we don't want, unfortunately that predisposes us to an immune system that is exposed to things that are making it harder for it to do its job, without going into too much detail. And then finally, we want to make sure we're absorbing and assimilating our nutrients. The column on the right around environmental cascades, we'll get back to that in just a moment after we talk about the gut. And so when it comes to digestive health, as it relates to inflammation, we really want to look at a couple things. This is a screenshot of an actual test that we use in our practice. We want to look at inflammation. Of course, if there is a bacteria or a yeast or a parasite that's causing the gut to be inflamed, absolutely we need to resolve that. And so one of the most common sources of infection that we see in our practice is something called small intestinal bacterial overgrowth, SIBO for short. We're going to talk about that in a moment. But that really looks at infection and inflammation in the upper bowel. We also want to see what's going on in the lower bowel. And so very often people can have candida overgrowths or overgrowth of bacteria that really shouldn't be there and shouldn't be there in large supply. And so we can actually test for that in the stool. And if it's contributing to their inflammation, we have to resolve it. Next is that marker that we talked about called calprotectin, which is probably the best marker we have as far as looking at overall inflammation in the gut. Calprotectin is something that was discovered years ago to help people distinguish between IBS, which is a very common, classically non-inflammatory bowel condition, and IBD, which is a classically inflammatory bowel condition like Crohn's or colitis. And so we can, again, actually measure inflammation in the gut. We also need to see if our digestive tract is able to break down the nutrients that it's exposed to. So I'm going to jump to this section right here. And we need to make sure that we're actually breaking down our fats and our proteins. And so we can look to see what's actually ending up in the stool for patients. Similarly, we can look to see if our pancreas, which is the main organ in our body, and along with our liver that produces digestive enzymes, is able to produce the enzymes we need to break down that food. If all of that is not happening the way it needs to, the food sits there, it ferments, and it causes inflammatory cascades, and it predisposes us to these types of infections. The next section you're seeing here, I mentioned that inflammatory pathway, the calprotectin, which is the first number there. And really, it's not all or none here. All this exists on the spectrum. And so this is a combination of understanding clinically how patients are doing and then matching the blood tests to that. And then finally, we need to make sure that our metabolism in the gut is appropriate. And so the bacteria that we have aren't just there to hang out. They're not there to cause infections. what they do is they have a very strong metabolic role. And so they produce certain nutrients. The most common are these short chain fatty acids, the SCFA that you're seeing at the top of that column, that really serve as essentially food for the cells of our lower bowel. And so if our short chain fatty acids are not an appropriate supply, we're much more likely to have inflammation going on. We're going to spend a lot more time talking about healing the gut and things to consider, but I just wanted to remind people here that even if some of these markers are high, even if we're seeing that there is inflammation in the gut and we're not able to break down our fats and our proteins, there's a lot of work that we can do as naturopathic doctors to help people resolve that. And so that really relates to all of the other pillars that we look at for all kinds of conditions, with a few gut-specific recommendations. So of course, it's important to look at what we're eating. It's important to make sure that we're sleeping effectively. We're going to talk a lot about sleep and its role in inflammation in part 2 of this series. Of course, it's important to look at the role of stress, but we can even give some nutrients that specifically heal the gut, things like licorice and some of the anti-inflammatory fats. We can even get some of those things from food itself. The most common one that people really like to use is glutamine. Well, glutamine exists in large supply in cabbage. And so if you're eating a lot of cabbage and a lot of other foods that have glutamine, you're likely doing some work to support the inflammatory cascades of the digestive tract. When it came to infection, we talked about the importance of small intestinal bacterial overgrowth. What essentially we have people do is it's kind of a complex test where we have people drink a solution and over 3 hours do breath tests, and we see if certain gases rise. And depending on where they rose and which gases rose, we can get a better understanding if there's bacteria in the small intestine, the upper part of the bowel right after our stomach, that really shouldn't be there. And if that bacteria is there and it shouldn't be there, it can cause symptoms like gas and bloating and headaches and fatigue. It's a pretty non-specific issue, but if our testing shows it's positive, there's a lot that we need to do to heal it. And so we've got our own protocols here at InnerSource Health. Sometimes that does involve antibiotics, but always it involves lifestyle and changing your diet, personalized to your needs. And most often it also involves herbal support. And so nature's giving us all these wonderful molecules to kill off these bacteria because they've developed their own defenses in their evolutionary history. And so what we can often do to support the work, we often have patients coming in who are just on antibiotics, we can support the effectiveness of those antibiotics, or very often, depending on the type of overgrowth, actually just use some of our natural antimicrobials directly. The challenge is just killing off SIBO isn't sufficient, because for most people, if you don't treat with this phase 2 approach, the SIBO eventually comes back. And so you need to make sure that you're also healing the gut from a comprehensive perspective, ensuring that the bowel movements are returned to normal, ensuring that you're killing off bacteria in all parts of the gut, ensuring that you're replacing some of the healthy bacteria. And so one thing that we use is something called prokinetics to make sure that our gut is contracting in the right way at the right times. And so you're seeing a couple things in there that work as prokinetics, things like 5-HTP, which people know about for sleep and stress and things like that. Things like ginger can be pretty effective in that sense as well. I mentioned gut permeability or leaky gut earlier. And so there's another test that we do where we give people a mixture that contains 2 different types of sugars. We don't need to get into the details, but basically, if the amount of sugar that ends up in our urine is higher than it needs to be, that gives us an indication that there's leaky gut, depending on which of the sugars ended up in our urine. And then similarly, if both of them are low, it gives us a sign again of malabsorption, that our gut isn't able to absorb some of the nutrients that are coming in. So we can see if there's too much coming through the digestive lining or not enough. Both of those require different treatments and different therapies. And we mentioned earlier this idea of the need to look at detoxification or oxidation, and that really falls in line with our ability to detoxify what we're exposed to in our environment. And so our body's main antioxidant is something called glutathione. This is a test that we do called the Dutch test, which looks at some of the other markers that we looked at, including the sex hormones and including cortisol function. But I pulled out this slide in particular because it also looks at our ability to produce glutathione. And glutathione is probably the most important thing that our body makes to keep inflammation and oxidation at bay. And again, we can directly measure that in the urine. If there's not enough, we replace it. And very often for people, we catch it before it's sort of too late. And I mentioned earlier this marker on the bottom called 8-OHDG. Basically what that's looking at again is DNA damage and how much our DNA is actually experiencing that oxidative stress and that inflammation. What we often find is that people with low glutathione, the one on the top that's highlighted in yellow, their 8-OHDG is also low. But typically, if we catch it early enough and we replace this glutathione, their DNA damage does not follow suit with that reduction in the ability to produce glutathione. So we can measure this from a really comprehensive way and treat, again, what we see. And finally, we spent a little bit of time talking about the role of just basic inflammatory pathways. We spent a little bit of time talking about the gut function. Again, that's really the seat of a lot of our inflammation. And we spent a little bit of time talking about our genetics. The truth is that even the person with perfect genes exposed to the wrong elements of our environment will mount an inflammatory cascade, because inflammation is what keeps us safe from those things. So for a lot of the people who come in who have chronic conditions, once we get past the basics and make those lifestyle changes, we also really need to ensure that they're not exposed to things like heavy metals, that there's no infections like Lyme and some of the other infections that come with Lyme, that they haven't been exposed to mold, which chronic mold can often cause long-term chronic inflammation. And then finally, to make sure that they haven't been exposed to a lot of the environmental pollutants and environmental toxicants that might be contributing to their chronic disease, things that we're finding in plastics and in pesticides, et cetera. And so for all these things, it's a different test. And certainly we're not saying that every person should do all these tests. We really want to make sure that we're being targeted based on, again, on our clinical experience, what we're finding for people. So this has been a very quick review of some of the testing. And you see a couple of others that people often ask about that we don't do a lot of here, but we do when it's most appropriate, things like food allergy testing, looking at the microbiome. And so there's certain DNA tests that we can look at for the microbiome. The point here is inflammation is this broad issue that can contribute to chronic disease in a very non-specific way. Most chronic diseases have inflammation at their core. And for most people, we have to do some testing to understand where that's coming from. And so really the goal here was to offer a survey of what's out there so that you can, again, feel empowered to go back to your doctor and say, well, you know, my gut has been an issue for a long time. Maybe my inflammatory joint condition like rheumatoid arthritis might be coming from the gut, as opposed to just an immune system that's just not doing its job effectively. Part 2 of this series, we're going to get into all those things in our toolkit as naturopathic doctors that we have to try to resolve these things. And so we're going to talk about nutrition and how to change some of those genes and the importance of exercise and sleep and how to repair the gut, but also our hormonal picture. We talked about cortisol as one example. What do we actually do to resolve that? So stay tuned for that. Part 2 of this series, before we take some questions, is next week, 2 p.m. Eastern time. And again, if you have any questions, feel free to email us at info@innersourcehealth.com or drkachko@innersourcehealth.com just to see it. And so let me just pull up, since Dr. Peter's not able to be on, my Zoom app on my phone and see if any questions have come in our remaining time. So one question here, does everyone have inflammation? Absolutely. But inflammation that's appropriate to the response and to what we're exposed to is healthy for us. It's what keeps us safe. Inflammation that's become chronic, that doesn't resolve within its appropriate time frame, that's really where we get concerned. But the truth is, everyone with a chronic disease, even if they're being told it's non-inflammatory, has inflammation as one component of that. And so it's important to ensure that alongside everything else we're doing, we're also addressing that likelihood for inflammation. That's a great question, though. Next question. Is there an example of a disease that has inflammation that we don't usually consider? Right. And so I think the classic example, we talked about irritable bowel syndrome, inflammatory bowel syndrome. The other I mentioned is something called rheumatoid arthritis, which in contrast to what's called osteoarthritis, we've always thought rheumatoid arthritis, which is an autoimmune condition, is at its core inflammatory, and osteoarthritis is basically just wear and tear of the joints. The research is showing us really in the last decade that that's not really true, that model is too simple. And we have to look at inflammation, even in this classically non-inflammatory osteoarthritis. It's not just about the bone and the cartilage breaking down. It's really about supporting the comprehensive system and the whole metabolism. And so if someone comes in with osteoarthritis, we are actually using anti-inflammatories, not just to reduce the pain, but to help resolve the underlying condition. But we're also looking at things like blood sugar and other aspects of the metabolism to ensure that they're not contributing and sort of lighting that fire in this otherwise inflammatory condition. So yes, most chronic conditions, again, even if for decades, and even if our medical textbooks say they weren't inflammatory, have inflammation, at least to some degree, and it all falls on a spectrum after that. And this is a great question, which really speaks to how much there is to consider here. The question is, what is most useful in reducing inflammation if a person can only make a few changes? And that's really common. What we see is that a lot of the people we work with can't just make these sweeping changes overnight. It's a matter of helping people fit these lifestyle changes within the context of the reality of their lives. And so what do we start with before we even give people a bunch of fancy botanicals and nutrients and things like that? We start with the foundations. And I'd say if the question is what's most effective, it always comes down to diet, sleep, and exercise. So much so that if a person can only pick two of those, I would actually choose diet and sleep, because the exercise isn't effective if people aren't getting the type of rest and recuperation that they need. And so what we're eating, the role of sleep, exercise, we're going to talk about all of that in part 2 of this series next Wednesday. If you've registered for part 1, you should get a reminder email about part 2. And there are a couple of other questions coming through, but we did promise to keep this pretty short and efficient. So if you have any other questions that we weren't able to answer, either save them for part 2 of this series, or again, email me directly. I think often part of the challenge with these talks is they're very broad and they don't speak to your specific needs. And of course, we need to make it very specific and personalized, which is the core of naturopathic medicine. So I encourage everyone with specific questions to just email me. I'll give that email one more time, drkachko, Kachko, at innersourcehealth.com. I'll be sure to get back to you. And if we need to set up a quick chat to really put this all into context for your needs, I'd be happy to do so. So thank you again, everyone, for joining. Thanks for sticking through on a Wednesday afternoon. This has been really well attended. So really happy to see that the importance of this is getting out to people. So thank you.